how some celebrities might be trying to prevent aging while they're in their 20s, and what is the risk versus the reward? The Fox 5 Morning News at 9 starts right now.
Serving all of San Diego, this is your Fox 5 News.
Recent news stories have shown celebrities and even regular women getting Botox in their 20s to prevent aging. Dr. Vincent Marin, board-certified plastic surgeon, is here to explain this trend. We also have Tanya Kiliansky, who is in her 20s and getting Botox injections. Good morning to you both. Thank you for being here.
You're welcome. Thank you.
Tanya, let's start first with you. Okay, so when I first heard that women were getting it in their 20s, I'm like, no, no, no. Why? Why would you get it in your 20s?
Although there's cosmetic benefits now, the long-term preventative care is what I'm really after. I have distinct wrinkles now, and if I can prevent it now, you know, for my future, why not?
And you've been getting the injections now for a little while, right?
A little while.
And you already see a difference?
Absolutely.
What's the difference that you see?
You can see the difference. I have very few lines up top, but it just feels better. I just feel better as a person, and that's about it.
Dr. Marin, thank you for being here. Let's talk a little bit about why people are doing this. Are you seeing more and more people come in, younger and younger, asking for this?
I do. It's one of those things, you have to judge who's the right candidate for this, but there are certain patients that have a really distinct forehead line or crow's foot line, excuse me. And it's something that you can actually see an immediate benefit, which is what most people go after with Botox, but you do see there's a long-term benefit. Your skin's kind of like an accordion that it's constantly bending in the same spot. And as you use those muscles over time, you're going to see those lines get deeper and deeper and deeper. And if we can prevent additional surgeries or too many surgeries by just doing small things along the way, I think it's worth it. So I see the benefit in it as well.
Okay, let's talk about, we have some celebrity pictures to pull up. We're going to start first with Kim Kardashian. And so I assume she's been getting it for some time now.
She did it on her show, and when you look at kind of what she's had done, she has better shape to the brow. You can see how smooth her forehead is. It doesn't really make her look different or changed or altered. It is an attractive result, but it's subtle. So I don't think what you're going to see with this is that she's going to look like a different person, but it does just look like she's got a smooth forehead. She says she stopped. I'm not sure that she really has.
It's weird, the before, I don't really see any wrinkles on the before, maybe a little tiny bit with the eyes.
And it can be, and that's the issue with younger patients, is that you don't necessarily see wrinkles at rest. It's where you see them is when they animate or when they express themselves. And if you limit some of that, you don't want someone to be unable to express themselves, but if you limit that, you can slow down that process.
Okay, we have another celebrity to take a look at. The next one is Jessica Lange.
Well, so Jessica Lange, obviously a beautiful woman, and you know, there's really, if you look at her before, not much there. There is the aging process that's happening, but when you look at how she's aged, you can see a lot of these lines, especially along her forehead. You can see the crow's foot. You don't have as much around kind of her kind of forehead area, but when you look at this, you can really see how these lines have gone from nothing there at rest. These are the same lines she would have as she moved her face, but now you see them at rest where those lines are there. And if we could slow down that process, she may not need as much work later on if it bothered her. Again, it's a personal decision, though.
Do you think that she's gotten the injections? Or?
I don't think she has, or if she has, you know, she may have started too late or done it too infrequent, because this really hasn't slowed down that process.
Okay. Next we have a fashion designer and icon and stylist and all the above, Rachel Zoe, who has her own show.
Yeah, and so this is one, I think, the best examples for a younger patient. Rachel's in her 30s, I think, and she up front in her really shows that she has some significant lines across the forehead and really looks much older than her age. And she's had, after this, she's had to go, and you can see how much better she looks now. I think it's not only Botox, but she's probably had a lot of laser resurfacing to get rid of some of those lines. So part of what I think she may have been able to prevent is additional procedures if she were to do Botox. And it's not that, you know, it's really that bad, but you can see certain patients are young and just genetically predisposed to have these lines that are more significant. So these are the patients where I see you can benefit from.
Okay, next we have Nicole Kidman.
Now, Nicole Kidman, I think, is famous for having a lot of Botox. She's a little bit more of an extreme, but if you look at where she is to start, again, not many lines, but she hasn't developed any lines over a course of time. You can see across her forehead, in between her eyebrows, and outside. I don't know how old she is, but you know, she's been doing this for years and kind of famous for the fact that her forehead never moves. And I think it's been something that you can see that she's aged better in that area. In that she hasn't been able to move, so you don't see that kind of just chronic use fatigue on the skin.
Now, it doesn't always go perfectly when you get these injections done. We're going to show an example of that right now. You do need to be careful. We'll show Reese Witherspoon, and as soon as we get that picture up, we will
maybe we
describe
won't,
what happened to her.
Some of the things, and it's important when you have Botox, is that you're going to end up needing a trained professional to do it and really understand the anatomy. The picture with Reese, and it's something that people can find online, but it's an image where she's got partial movement of the forehead, so it looks odd if it's not done properly. So if you don't have something that looks even and balanced, that's where it's going to be a dead giveaway that you're doing something like this. So we want something to look kind of polished and put together and balanced within kind of the facial features. If you don't pay attention to anatomy and understanding where the exact Botox injections need to be, you can cause some of these secondary deformities.
What are some of the other drawbacks? I think you have to tell your doctor if you're taking any other medications, because it could possibly interact with that.
There's not too much in the way of medications. Patients taking aspirin or ibuprofen, you can't have increased incidence of bruising. That was one of the things that Kim Kardashian on her show had. She had a little bruise, and you know, it was a big issue. Fortunately, it's something, unless you've had a previous reaction to that, it's not a major deal, so it's something that's usually very well tolerated. There are a couple different options for patients, so if one Botox doesn't work, there's another trade name, Dysport, also works, so they're all different options.
Dr. Marin, Tanya, thank you both for being here this morning. And if you'd like to contact Dr. Marin, you can do that at Marin Aesthetics. That's located in Del Mar. The phone number is 858-638-9800. All you have to do is go to fox5sandiego.com and click on that Scene On button. Okay, Raul, back over to you.